Hi everyone, welcome to the Ohio Health MS Hot Topics event. We are so glad that all of you could join us on this Friday, and I'm thrilled to be joined by my colleagues within the MS Center. You're going to hear about several topics with bite-sized bits of information because we want to keep you awake and excited to learn more about MS and how best you can manage it in your everyday life. We're going to start out with a talk on fatigue. We'll move into progressive MS updates. We have Lauren Esposito here from the Neuro Wellness Center who will be discussing MS wellness opportunities and also run you through a quick workout. We'll talk about emerging MS therapies and new treatments and research, and then we'll also talk about the female experience with MS in regards to pregnancy, pre-pregnancy, and menopause. And then we'll have time for Q&A at the end. If you have questions, please type them in the chat throughout the program, and we'll work to answer those. And I look forward to hearing what our wonderful colleagues have to say. So I'm going to go ahead and turn it over first to Dr. Doug Wu, one of our neurologists and MS specialists who is primarily in Athens, Ohio at Ohio Health O'Bleness. Thanks, Doug.
Okay, thanks, Jackie. It's very kind. Hello, everybody, and welcome. So today my topic was talking about fatigue, sleep, and life with MS in about 15 minutes. So we'll hit some high points. So obviously, if you've been dealing with MS, you know that fatigue can be a very persistent and constant feature of life, and obviously there's a lot of different things that can affect your energy level. Sleep disruption, a lot of times just trying to get enough sleep in spite of all of life's distractions and things that can be something that can affect your energy level. A lot of times if you have MS, then there's a number of things that can affect your motor function. You can have spasms in an affected limb that can disrupt your sleep. You can have weakness, which can make it harder to move around, or you can feel off balance, either because something has disrupted the balance centers of the brain, or because you have troubles with moving an arm or a leg or even coordinating them. And these things combined, they can increase your work of mobility. It can be harder to move around because you have to concentrate more and expend more mental energy to keep from falling or to get from one place or to another. MS fatigue has been well described as just being very persistent, and I think probably you're very familiar with all of the different medications that have been tried and which can help, such as modafinil or armodafinil, also known as Provigil or Nuvigil, methylphenidate or Ritalin, also known as Concerta, or dextroamphetamine. And these medications can be tried to try to give a little bit of boost with them. Or if you have depression, feelings of being depressed and not wanting to do anything, wanting to stay inside the home and not get out, all of these can contribute to feelings of fatigue or malaise. And obviously these are all things that you can discuss with your provider and your physician in trying to improve upon. So that was just an overview of the things that we try to address when we're looking at somebody's fatigue. But there's a couple other little tidbits I thought I would share. One of them is that if you have MS, then you're actually at about a 15% lifetime risk of developing other conditions that can cause fatigue. Hypothyroidism is one of these, but another one is B12 deficiency. And one of the tidbits I wanted to pass along is that certainly a lot of times physicians will check a B12 level to see if you're deficient in B12, but one of the tip is that actually there's another test you could ask your doctor about. It's called a methylmalonic acid level. It actually could be more accurate in predicting whether you have enough B12 stores or not. Just as a review, when you're in your body, B12 in your body, it catalyzes this reaction where your body takes methylmalonic acid and it converts that from methylmalonyl-CoA into the substance called succinyl-CoA, which is then used to make myelin. And as everybody knows, myelin is important in composing the sheath that surrounds your nerves and protects them. And so if you're low in B12, if you don't have enough of that, then this reaction doesn't get catalyzed, and actually you don't produce myelin, and actually this can contribute to loss of myelin or demyelination, With MS, if you have an attack, then the immune system will attack and cause inflammatory demyelination, where the white blood cells will strip off the myelin from around the nerves. But if you have B12 deficiency, that myelin can just slowly degenerate over time. And this process can occur over 5 or 6 years because your liver has enough stores of B12 to last for about 5 or 6 years. But if you're not absorbing it, or if you're taking a medication that interferes with the absorption, then you'll lose the myelin. Now again, you can check a B12 level, but you can check a methylmalonic acid level. And if you're low in B12, this methylmalonic acid level will become elevated. And if it's elevated, then that actually suggests that you're low in B12 no matter what your actual B12 level is on the test. And then you can take B12 and try to slow down and reverse actually the loss of myelin. So B12 deficiency can cause fatigue by also reducing your body's ability to produce red blood cells, and it can make you anemic, but certainly it can affect the function of nerves across your entire body and lead to problems with memory and weakness, sensory loss, in addition to just feeling more subjectively tired. If you do a B12 deficiency, certainly you can get injections. That's traditionally what's been done, but actually they've done studies and found that if you just take enough B12 as a pill, you can actually get more of it absorbed into your body to correct the deficiency. And you'd need anywhere from 2,000 to 4,000 micrograms. Either take it as a pill that you can swallow, or you can put under your tongue and let it get absorbed through the lining of your mouth, and that would be enough. And you can get B12 pretty readily over the counter. You want to make sure that it's a brand that's been what we call certified by the USP, which is a company that certifies that products actually do contain what they're supposed to contain, and one of these is nature made, but actually I found that Kroger's pretty good too. So again, you could get your level checked, or you could start taking B12. I don't think either one is bad. Another tip, oops. So something else I thought is that trying to reduce saturated fat in diet. Saturated fats are those that are actually solid at room temperature, such as butter or coconut oil. And a while ago, I remember that there was this diet called the MS recovery diet, which gained some popularity. There are other diets as well that have been tried and which seem in certain people to help with reducing feelings of fatigue, potentially to reduce relapses and whatnot. But it was thought these diets were good for people with MS to take. And they all had a number of different features, but it seems like one of the universal findings was that the diets, a lot of times people found that if they reduced their amount of saturated fat, they actually felt better. So if you think about foods that are high in saturated fat, again, it's these products where the fat is actually solid at room temperature. So red meat, where you have a chunk of beef fat sitting there. Whole dairy products such as butter, coconut oil, which is solid at room temperature, palm oil, ice cream, baked goods, primarily because a lot of baked goods, they use things like palm oil or other cheaper things. And there's actually studies been dating back since mid-2010s or so showing that saturated fat can actually stimulate the immune system in a way and potentially could trigger relapses. I remember there's this one patient I had who was an organist in church, and she had MS, and she actually went on to the MS recovery diet and followed it to the T for about 6 months and felt really, really good. She actually felt strong enough and had more energy that she graduated from using a walker to just needing a cane. And I distinctly remember one Sunday morning she was making herself scrambled eggs and thought, you know what, I'll just throw some cheese on top of it, just sounds good. And she did that, and she said she felt so tired and bad after that just one episode that she had to call somebody to take over the music for that day in church. It was somebody with a guitar because she just couldn't play the organ. And after that, she limited her amount of saturated fat quite strictly after that. Obviously, it's just one anecdotal case. But again, saturated fat, if you can reduce the intake of that actually has other health benefits as well in atherosclerosis and stroke and coronary disease, that this is something else you could try to focus on. Again, trying to follow the diets, it can be difficult sometimes, but if you just think about just reducing saturated fat and focusing on that one thing, that might be easier to do. I keep pressing the wrong button. So another thing that I've been finding as a pearl is that sometimes people with MS and they have their fatigue, it may not necessarily be from the MS itself. If somebody has ever had any history of any kind of whiplash injury, obviously from a motor vehicle accident, but even as a young child, taking a tumble, and it's amazing how when you ask people's histories, how people as kids, there's a lot of high impact kinetic injuries such as falling out of a shopping cart, falling out of a tree, falling off a horse. Maybe it's because I practice in Athens and it's country that we do these things. But sports injuries or taking a slip down the ice and falling down the stairs, these high kinetic impacts, what they can do is they can increase your risk for developing what's called myofascial trigger points. And a trigger point, essentially, what happens is that if you have any type of whiplash injury, such as the person on the left, it actually strains at the muscles. And there's a particular muscle along the side of the neck called the sternocleidomastoid, which is prone to injury. But actually, the sudden whiplash will cause tearing of the muscle fibers. And afterwards, when they heal, they don't heal up cleanly. They heal up in these areas of very focused, tight knots called trigger points. And they can develop trigger point complexes. And it seems that these develop over time, and certainly where they're located in the neck, they can cause a lot of strain in the neck and give rise to headaches, neck pain, shoulder tightness, sometimes even dizziness. But a lot of people report just this feeling of being drained and feeling tired, not necessarily falling asleep, but just hitting a wall and not having energy. And these are descriptions that I previously assumed were all from MS, but it's interesting how certain people, it's not just the MS, it could be from these. So if you've had any history of any type of whiplash type injury or high kinetic impact, you don't even have to have head injury and get knocked out or concussion. It could just be some bad fall and you break an arm, but it was enough to cause whipping of the neck muscle, and you could have these trigger points here. And the trigger points, it's interesting, they describe them as occurring in any number of skeletal muscles, including the legs and the abdomen, and people have described symptoms to me where they say, yeah, I have neck pain here, but it wraps down across my front, wraps around the back, underneath the armpit, across the chest, in the legs and calves, but going up into the back, to the knees, to the hips, and it can cause a lot of different problems. So this is something that you could be evaluated for. There are certainly a number of different techniques to try to basically loosen up the muscles. Stretching, either at home or with a professional. Physical therapy, but not just any physical therapy. It's for a therapist who is specially trained in what's called myofascial release. If you happen to live in an area where there's an osteopathic physician who can do osteopathic muscle manipulation, there's also injections. Chiropractors can be this as well, yoga. The list goes on and on about how to try to loosen up these muscle knots. But again, it can contribute to fatigue. It may not be all of that, and certainly if you have no history of trauma, then you probably don't have this. But again, it's another little wrinkle, something that I've seen. Obviously, sleep, and the second part of the talk was how to try to optimize sleep. Certainly there's a lot of things like pain, having to get up a lot at night to go to the bathroom, that can disrupt your sleep. And a lot of people they say that they just can't turn their brain off, and there's worry. And certainly in the world nowadays, there's a lot of stuff to think about. Again, trying to work with your provider to try to address these issues can potentially help with sleep. It's interesting, a lot of people are saying that they take melatonin. It turns out it takes about 2 hours for melatonin to actually kick in. So if you take it at bedtime, it actually won't kick in until maybe midnight or so, depending on when you take it. That's the one thing about it. But certainly trying to engage in some physical activity during the day, either late afternoon or early evening. A lot of times that actually will help people fall asleep better and whatnot. And then in terms of life, I was thinking about what could we talk about life. And I think something, certainly living in a big city or whatnot, that you don't really get enough of is what's been called nature therapy. In Japan, actually, there's a program called Shinrin-yoku, and it translates into forced bathing. But this has actually been a program done in Japan for since the 60s or 70s, I think. I remember hearing about it back then. And there was a heavy interest in trying to see how they could harness the benefits of being in nature on health. And they did a number of studies looking at people and how they did when they're exposed to nature or spent time in the forest and bathed in the trees, the pine air and that type of thing. And they found that they're actually rather unmistakable and significant benefits in things like stress, depression, energy, even other things such as heart attacks and that type of thing. It was quite interesting. And so nature therapy, if you dig into that, there's a number of resources about it. You don't actually have to be thinking about going camping and spending 24/7 a summer by the lake and that type of thing. It could be as simply as just, instead of being in the house, going outside, obviously when it's a nicer day, and hanging out there, or just going on walks through a forest or some place where you can hear birds, see trees, smell the cleaner air, not hear the traffic, and that type of thing. And if you don't have the opportunity to go outside, it could be as small as having a plant in the window. Here you can see people are going pretty full blast, and you can obviously get into it pretty heavily, but it doesn't have to be getting out to nature, but having things around. And it's interesting with the research, it may not be just that it's a quieter place, you're not distracted. Certainly with plants, there's a number of different chemicals which are in plants, such as terpenoids and other things that can lead to the aroma or the flavor if you eat them. If you think about, for example, just being in a pine forest and just taking a whiff and seeing how you feel, it's actually not just, oh, I'm in the trees, but actually there's been some studies with fMRI, functional MRI and things like that, showing that when you have this intake of these natural compounds, such as the odors from pine trees, it actually can induce changes in your brain which are sustainable and contribute to helping feel better. So that doesn't mean to say that you need to have a pine tree in your house and things like that, but certainly it seems that having plants or nature around, it actually can contribute biologically to things or whatnot. And it's actually not just limited to plants. It could be animals, pets, that type of thing. Certainly cats or whatnot, or if you're not a cat person, it has the opposite effect and you look for something else. But it's that type of thing. And so they found that in very general terms, if you just were exposed to about 5 minutes of something nature related, that was enough to actually improve your mood, self-esteem, and even your motivation for a degree of time. And in very general terms, at least in Japan, they're saying that if you could get about 2 hours per week of nature therapy broken up over the 7 days, that was actually enough to cause some change in how things are. It was something that people looked forward to and they felt better and got a little bit more energy to get through the rest of life. And that was about all I had.